Welcome to Navigating Lyme Disease for Patients and Doctors with Dr. Daniel Cameron. Dr. Cameron, thanks for doing this third episode where we'll be focusing almost exclusively on children with Lyme. Thanks for being here.
It's always a pleasure to work with you.
Thank you. Thank you so much. What we're going to do is go back just a little bit. From episode 2, we talked about PANS and PANDAS, a couple of terms that are very common in use for children who have issues with Lyme and other diseases. Isn't that correct?
Yes.
Where we left off with that was really touching on issues that children have. And since we're going to be focusing on children today, what I wanted to do is wrap up with the 7-year-old girl's case study from the end of chapter 2. And what I want to talk with you a little bit about is how intense the symptoms were that this little girl went through and how debilitating it was and how she was able to come through it on the other end. So can you talk just a little bit, give everybody an overview of this 7-year-old child who presents with Lyme disease?
Yeah, this was a case that was published by Cross and colleagues in 2021. So I thought it did a great job of really highlighting the challenges that a mom has and a doctor has at recognizing PANDAS and Lyme disease. Because they started out with a 7-year-old girl who had physical and neuropsych issues after going to a tick area. Now, this was 6 months later, so they treated her at the time for a series of strep infections. And it's pretty much known that some people with strep seem to get neuropsych issues, neuro issues, and so they've been talking about maybe they'll get OCD, they'll get tics, and with the range of symptoms they're getting, they decided to call it Pediatric Autoimmune Neuropsychiatric Disorder. I'll break that down. It's pediatric because that's where they first recognize it. It seems to be related to the immune system, so they call it autoimmune. And it's neuropsych, that's the N, because it affects the neurologic issues, but you see it more on the psych side. And it's associated with strep, that's the AS at the end. But over time, they decide, well, why don't they give treatment for strep and that'll take care of it. But there's plenty of kids that weren't getting better, even though they got amoxicillin. They thought, well, maybe they have to use IVIG, intravenous immune globulin. But since often the child would get better with the treatment for strep,